everybody around the world. I hope all of you are fine and blessed and in God. My name is Dr.Imada Laura H.P. Just call me Dr. Laura. I'm a medical doctor with 15 years work in almost every health field and with a special interest to help muscular dystrophy patients. Right now, I open my private practices at Jl.Kebagusan Raya Gang Kriep, number 53, Jakarta, Selatan.Indonesia. And you can contact me with consultations online through my email dr.laurainternational@yahoo.com or my cell phone number 622-1727-1766 or my cell phone number 628-521-926-8188. Thank you for this great opportunity to help all of you to be cured and all of us to be cured and success in God. Right now, I'm giving you explanations, informations, the drug that is useful for muscular dystrophy patients, and also combinations treatment that I will tell you through this video. The mechanism why patients of muscular dystrophy are weak is because the rupture of the cell muscle membrane because of mutations of genetics. It could be inherited, it could be spontaneous. Now, while we are waiting for the technology that are promising to make muscular dystrophy cure, we do what we can do right now, minimum to slow the progressivity. But always remember, cure depends on God, not in technology. Okay? This is the drug that supply the energy to the nerve and the muscle. Yeah. Why we need this drug? Because almost all muscular dystrophy patients is so easy to get tired and weak because the degenerations of muscle cause of the rupture of cell muscle membrane. So we need energy energy that we should supply to the nerve and muscle. But we must combine this drug with exercise, physiotherapy, always movement, as long as it's comfortable and not make us tired. The physiotherapy need to be consulted from the experts and physiotherapists. And aquatic therapy, occupational therapy, recreational therapy need this drug because if you don't use the drug, you will get easy to be tired and the effect will be minimum. So the mechanism of this drug that supply the energy to the nerve and muscle by physiotherapy, exercise or movement that is suitable with your physical condition as long as it's comfortable, there will be balance of the weak muscles that will be balanced with the healthy muscle, because the healthy muscle is going to be stronger and it will balance the weak muscle. By that way, the progressivity will be slower. And if the symptom is mild, it almost can be cured. The dose of the drug that supply to the energy to the nerve and the muscle is 2 gram twice daily, or 2 times 2 gram, or 2 gram in the morning, 2 gram in the afternoon after eating for adults. For children, 1 gram twice daily, or 2 times 1 gram, or 1 gram in the morning, 1 gram in the afternoon after eat. But before you use this drug, make consultations with the expert of muscular dystrophy. The side effect of this drug is dehydration, and it can disturbances of the brain, and sometimes it's disturbances of the stomach, diarrhea, or hypertension, dizziness. But from the research, for 6 months using this drug, it usually doesn't have any side effect. And please drink water 2 liters every day for adults, or 1 liter for children every day if you use this drug. Because if not, it will give the dehydration. And don't drink coffee while you take this drug, because it's going to be dehydration, and the function will be less. And this is the type of capsule, and this is type of the powder. Some of type of muscular dystrophy have difficulty swallowing, so there are powder that will be useful for muscular dystrophy patients that is have difficulty swallowing, and the price is much more cheaper than the capsule. And we have to mix it with the water. The dosage is the same with the capsules, but we have to translate it to the gram of the teaspoon. Yeah, and beside that, there are other drugs that is useful for bioenergy, antioxidant, growth control, and some of the research say this is to protect the rupture of the cell membranes that cause degenerative of the muscle, that make the muscle weak. And with using this drug, it will make more energetic, and the area that doesn't affect with the mutations or rupture membrane of the cell muscles will be prevented, and it means it will slow the progressivity, or it will stable of the patients and can have a good quality of life. It's 100 milligrams daily. And there are forms of, beside capsule, powder, Nutri-Gel. Yeah, Nutri-Gel. It's look very beautiful and delicious and increase our appetite. It's very useful for children, because this Nutri-Gel contains vitamin and electrolytes that will promote the strength of the muscle, and it will make the children enjoy eating the drug. It's very, 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 very unique type. Yeah. this this we only eat this Nutri-Gel one one once a day. Okay, and you have to remember, besides using the drug, you have to do physiotherapy, aquatic therapy, occupational therapy, recreational therapy, meditations that created by myself that you can see by video YouTube, and also you have to eat food that promote the strength of muscle, eat high quality and quantity protein. Yeah, and if you don't have enough money to buy these drugs, you can change it with fish or meat because it contains protein. And you can buy this drug by through me with making consultations online first, and I will give you the right treatment for your muscular dystrophy disease after anamnesis, physical examinations, or minimum I see your medical record and also laboratory test, DNA test. Just send it to me, and if you want to order the drug through me, I will send it to you. And but we also have to remember, cure depends on God. Do what you can do right now while waiting for the best treatment of the technology that is promising for the near future. And please follow the technology. Try to be the patient clinical trial, because by this way, if you get the treatment with following the clinical trial that is suitable with your physical conditions and suitable with the criteria of the researcher, you can get cured with minimum cost. I make cooperations with researchers abroad for clinical trial, but the decisions maker depends on the researcher abroad. And I am also successfully to slow the progressivity of muscular dystrophy, and right now I'm designing for the research for the best treatment of muscular dystrophy with low cost. But always remember, cure depends on God. Not depends on the doctors, not it depends on the technology. Doctors and technology is only the mediators of God hand to make you cured. Please pray. Do the best what you can do right now, and I believe God will bless all of us to be cured and also give much more success. Everything is possible in God, so never give up. Thank you very much. May God bless all of us to be cured and achieve much more success. See you again from Dr. Laura.